price 350, but now it's 400, 500, and now we don't have the money to buy. Now that it's expensive, we always use pieces like clothes, we wash it, we use it. Before we used to buy card of 200 to 50, but now it's very expensive. They sell it 500 naira, and we are still students, can't afford it.
I used to use pieces sometimes, but now the always is very high. If they can give us free or reduce the price, then we will know how to be saving money and using it to buy all.
We notice that menstruation still have a lot of attachment. When I say attachment, it has social barrier, religious barrier that make these girls or women that debar them from a lot of things. Especially, look at the girls, because they cannot afford to buy pad or sanitary pad. They miss school, they cannot go to school. Some of them, look at it, some of them in a month, for 5 days will not go to school. In 2 months, that is 15, that is 10 days. In 3 months, that is 15 daes in a term, and a term is 3 months. When you remove 15 days out of 3 months for a girl, at the end of the day, she will not be able to cope in school. She will miss or drop out of school. Then look at them again, the activities, economic activities they are supposed to engage in, they cannot engage in it because they are having menstruation. Menstruation that's supposed to be a blessing. It's a blessing to us. But culturally, like we were in a community in Guadalajara, we were told, the girls told us that one, they cannot cook for their father. As a woman, you cannot cook for your husband because you are menstruating. Because you are menstruating too, that is the cultural aspect. Because you are menstruating, you cannot sleep with your husband as a woman. So on like that. Also, we find out that most of them in the community, especially when you go to the rural area, you see that they lack access to water. No water to clean their blood, to clean whatever they are using. And we should not forget that in the rural area, what they use is rag, because they cannot afford to buy pad. The normal pad that is 350, 450. So some of them will go into using things that are not hygienic for them, like using rag. Some imagine a girl using cow dung because she wants to go to school, because she wants to mix up with others, and she does not want to drop out. She will go for cow dung. She will go for foams that somebody has disposed. That's what they go into. Some use leaves. There was a girl we met. It was a rag, a dirty rag she was using. We asked her why. She says because she wants to go to school. So she has to use the rag.
My name is Dr. Uche Onufo. I'm an obstetrician, gynecologist, and I have my practice in Abuja. Menstrual cycle is a phase in the life of every girl where she begins to become productive, in the sense that she can get pregnant. And it's the menstruation, which I guess we're talking about, is a time in that phase where she sheds off the lining of the womb when she fails to get pregnant. So we realize that many girls from the age of about 10, 11, 12, they begin to have this, what we call the monthly flow. We have a few girls who begin at the age of about 8, some even start earlier than that. So every month we find these girls shedding off the lining, which we call the endometrium. It usually will last for between 2 to 7 days, but for most girls, they have it for about 3, 4, 5 days. And after that, they go on to ovulate, and in the event that they don't get pregnant, the next month they get to see their menses. So for every girl who is potentially productive, who is potentially going to get pregnant in the future, she has this monthly flow which occurs in her for several days. Majority of people will use sanitary, what we call sanitary pads, the disposable sanitary pads, which they change several times a day. But we find out that there are some persons in our environment who are not financially empowered, whose parents may not have enough to get the pads. They resort in using, some talk about using clothes, usually old clothes, some talk about using rags, some talk about using foams so that they can contain the blood. Many of these practices are really not safe for the girls because many of them do not have access to clean water or soap or detergents to help them wash these materials to get them clean, because for many of them they have to keep changing several times a day. So when they get into these practices of using rags and some unsanitary materials, it could result in infections of the female genital tract, the vagina, the uterus, and sometimes the fallopian tubes in the girls. The fallopian tube is the organ that the eggs, when a girl ovulates, the eggs will come out from there and get into the womb. So these parts of the bodies could get infected and it could cause a challenge to these girls over time. And the fact is this, if it happens just once in a month, it may not be a big deal, but when a girl starts at the age of 10 to start menstruating and she's doing this every single month, maybe 12 times in a year, and then it takes several years, she could become at risk of some of these organisms and it could affect her future fertility.